My name is David Chandaplay, and my topic is why do so many drugs look like dopamine? What is dopamine? Dopamine is a neuromodulatory molecule, also known as a hormone, naturally created by your body that is responsible for inducing emotions such as pleasure, satisfaction, and happiness. And the molecule on the left is dopamine, and the image just shows that dopamine equals happiness. Dopamine's chemical formula is C8H11NO2. Dopamine comes from the catecholamine family, and its chemical name is 4,2-aminoethyl benzene 1,2-diol. Uses for dopamine. While dopamine is naturally produced in the body, it is also produced as a drug for medical use. When dopamine is used as a medicine, it can constrict blood vessels and increase muscle contractions, leading to increased heart rate and blood pressure, which is a problem for people who have prior history of heart attacks or cardiac arrest, because if they take dopamine medicine or like too much of it, it can increase the chance as well of them receiving a heart attack or cardiac arrest. If the consumption of dopamine medication is abruptly stopped, the withdrawal symptoms can include sudden high fever, muscle stiffness, kidney failure, and other problems with sleep, mood, and pain. Some dopamine agonists are known for their uses in treatments for Parkinson's disease, because Parkinson's disease targets the nervous system, and dopamine agonists can help activate some of the dopamine receptors in the body, which helps, say, if a patient with Parkinson's disease has problem moving the hands, the agonists will help activate the nerves and let them move easier, in a sense. What are dopamine agonists? Dopamine agonists are substances that can perform the same or similar effects that dopamine can give. So this picture is a diagram of healthy and unhealthy neurons. So on the left, we have a healthy neuron with the yellow dots being naturally made dopamine, and with the white pieces being the dopamine receptor. And with those two combined, it provides normal signaling. So, and in the middle, this is a neuron with Parkinson's disease. There, you can see there's a decreased amount of dopamine, and as such, there's not as much dopamine binding to the receptor, so there's impaired signaling. And on the right, there's a neuron with Parkinson's disease, but dopamine agonists are sent into the body. So the orange ones are the agonists, and you can see that they're binding to the receptors just like the how natural dopamine was doing, and it's giving improved signaling to the body. Um, Types of dopamine agonists, these are one, ones that are medically used in the hospitals, prescribed by doctors for patients. We got morphine and oxycodone. These two are opiates, and mainly help with pain relief. Apomorphine, also known as Apoquin, pramipexole, also known as Mirapex, rotigotine, also known as Nupro, and ropinirole, known as Requip. These four are widely known for being used as treatments for Parkinson's disease. Types of dopamine agonists, but this time these are illegal drugs that are mainly made in, well, nowadays they're made in like illegal drug labs, and also illegally distributed. It is not advised that you take these because they have many adverse effects for your health, and the withdrawal symptoms are sometimes even worse. So we got cocaine, methamphetamine, fentanyl, lysergic acid, diethylamide, also known as LSD or acid, and heroin and MDMA. MDMA is also known as ecstasy. Um, and so these drugs, mainly cocaine and methamphetamine, they were used in the past before. Cocaine was put in drinks such as Coke and the soda, and methamphetamine was used widely in World War II by both the Allied and Axis forces as a stimulant and for like performance enhancing effects. why do so many drugs look like dopamine? The previously listed drugs, both medicinal and illegal, and dopamine all build off of the molecule benzene. Because when the chemical structures are drawn out and inspected, in every single compound, benzene is present. So on the bottom right, you can see there's a picture of dopamine and apomorphine. In apomorphine, in red, dopamine is highlighted, its chemical structure, and on the leftmost side of the red part, you can see the benzene molecule in the hexagon. And overall, when the other chemical groups are added to benzene to produce drugs, the compounds will at some point have parts of its structure that is similar or identical to dopamine. So dopamine and dopamine agonists are similar but not the same. So final part is, how does this relate to Chem 1031? So this I just listed out all the chapters and the sections that I think are relevant to this topic. We got chapter 2, atoms, molecules, and ions, and chemical formulas. Chapter 3, electronic structure and periodic properties of elements, with sections 6 and 7, the periodic table and molecular and ionic compounds. Chapter 4, chemical bonding and molecular geometry, with sections 1, 2, and 6, with ionic bonding, covalent bonding, and molecular structure and polarity. And finally, Chapter 5, advanced theories of bonding, with section 3, multiple bonds. Thanks for watching.